So here is a sneak preview into the advanced coherency course, which is very, very in-depth. It begins with the launch party webinar. If you missed it, then you can go and look at that. And Kimberly Schipke's opening lecture is on the biofield. This is Kimberly's life's work, and it is all written up on her website, but it's so wonderful to hear her explain it and to have the imagery as well. My opening lecture is on the pendulum. It is a unique assessment tool. I go into the history of the pendulum and why it is a very valuable tool for you to have in your clinic. I then provide you with a lecture on the science of light therapy and then new concepts in joint stiffness. So this is very, very new. Traditionally, we've used many modalities to treat joint stiffness, but now you can use light. And this goes into the in-depth history as well as the science on how to do that. We then have a patient with a wrist injury, which is Kelly Zeman. And this is very good because it details your traditional therapy, the proprioceptive management of the wrist. And then physics-based medicine, you will see Kimberly treating the patient as well as the in-person sessions using physics-based medicine with me and Kelly. And you also get to watch the interview with Kelly where she reflects on the treatment. We then have an in-depth patient assessment and treatment with a humeral fracture and radial nerve palsy. So I go into great detail about the radial nerve, particularly for those who are not hand therapists. You will see my intervention, which is all physics-based medicine, as well as the other therapeutic tools that you can use. You will then see Kimberly treating this patient in her virtual clinic. And you can then go and watch this in-depth interview with Deepti, which provides so much insight, as well as the highlights of that interview. We then have a patient with a circular saw injury, and there is a guest speaker, which is Gabriella, who treated Stephen in London. So you will have a very, very in-depth look at the traditional treatment, and that using the casting motion to mobilize stiffness technique. And then you will see 3 phenomenal sessions with Kimberly, 3 different interventions using extremely advanced coherency tools. And this really is the heart of this course, and it shows you exactly what you can achieve. And then we have the interview with Stephen, as well as kind of integrating the treatment and the interview that we did. So you see it all come together, and you then get to see a beautiful presentation that Stephen did, which is the journey of the concert pianist. We then show you the anatomy of the CMC joint. This is an in-depth anatomical lecture. And my intervention, which is both traditional and physics-based medicine. You will then get to see Kimberly's virtual treatment on how to manage arthritis of the CMC joint using her tools. And we have an interview with Joan as well as the interview highlights. There is so much in that interview which just ties up, and it makes one understand that we may be injuring or developing diseases, and yet there can be one moment in time that sets it off, because a lot lies dormant within us. But then we have these triggers. I then teach you nerve compression. So a patient with bilateral radial and cubital tunnel syndrome, carpal tunnel, cubital tunnel, and radial tunnel. So we address all those syndromes, and I show you in depth how to use physics-based medicine to treat all of those 3 conditions. There is a section on tendinitis, ECU tendinitis, lateral epicondylitis, and de Quervain's tenosynovitis. These are all common conditions, and they often fail with traditional therapy. Patients end up having steroid injections and surgery. So this shows you exactly how to treat these conditions using physics-based medicine very successfully. Trigger finger. is another very common condition, as well as trigger finger that's combined with nerve compressions. So you will see a patient that has carpal tunnel syndrome, bilateral carpal tunnel syndrome, as well as trigger finger. We then go on to patient testimonials. There's a wonderful patient discussion with a patient who's treated in the nerve compression section with the cubital tunnel syndrome. There's a link to purchase the laser, and there's a very in-depth reading list as well as references. And then there is a section where you can go on. This will be a section that will grow. Each month, we're going to be doing a virtual hand clinic, and there will be a link for you to purchase the specific virtual clinic, and we will explain the details as well as give you the highlights to see if you want to go on and learn more. So this is a very in-depth course. We are covering a range of conditions, and we do hope that you enjoy it.